There were 2,000 new cases of the coronavirus in China this Monday, and while the authorities say the infection rate is falling, the World Health Organization says we can't know if it's peaked.
The data also appear to show a decline in new cases. This trend must be interpreted very cautiously. Trends can change as new populations are affected. It's too early to tell if this reported decline will continue. Every scenario is still on the table.
Now, this is a live map from Johns Hopkins University. It shows cases around the world, and we now know there are over 70,000 cases just in mainland China alone, and that over 1,700 people have lost their lives. Most of those deaths are in Hubei province in China. Here are some pictures of a hospital there shown on Chinese state TV. This is a new temporary hospital in Wuhan, which is the capital of Hubei. That gives you one impression. This footage will give you another. It's unverified, but from Chinese social media, and apparently shows us another hospital in Wuhan, and you get a feel for the pressure that the staff and the facilities are under. This is also interesting. There are huge restrictions on people in Hubei. 60 million people have been ordered to stay at home. Only one person per household is allowed out every 3 days in order to get food. And if you go to get food, before you're given it, you have to have your temperature checked to see if you have the virus. And then I also wanted to show you this, because so many people are stuck indoors, they're having to think of new ways to exercise. This is a fitness instructor who's now started doing her classes online, so all of the people who normally take part can still do so. Now, the Chinese authorities are saying they're considering postponing the annual session of Parliament. That begins on March the 5th. And while they make that decision, they've already been hosting a World Health Organization delegation. Here's one WHO spokesperson.
So it's at the stage where we need to look at what's happened in China and consider all the evidence. As you know, there is a mission right now. We're not giving much information about that. We're letting the scientists get on with their work with their counterparts. But the idea there is to have a really full and free and frank exchange, look at what has worked, look at what is not working, and what can be done differently, and also what needs to be applied to the rest of the world.
Now, in Hong Kong, there are 58 confirmed cases. We know there are shortages of hand sanitizer, face masks and toilet paper, all because people are stockpiling. And have a look at this scene outside one supermarket in the Mong Kok district of Hong Kong. Men with armed knives robbed a delivery man of hundreds of toilet rolls. The BBC's Martin Yip was there.
I just got inside, and the rack which would have stored around 1,000 and 2,000 toilet rolls is still empty. Although, according to my family and my neighbors, some toilet rolls did return in the day. Fortunately, the other thing that was on panic buying just another week ago, rice, is now back on shelf. It's reasonably stocked right here, so a bit of good news here.
Let's bring in Professor Paul Hunter from Norwich Medical School, who's live with us. Professor Hunter, thank you very much indeed for your time.
My pleasure.
There's so many elements to this story now. Help us step back a little and judge where we've got to with this crisis.
Well, I think you're quite right. The number of cases in China do seem to be declining. There's been a little bit of uncertainty over that because the way the Chinese had to change the way they reported to include clinical cases. And I suspect that was because they were getting somewhat short on test reagents, but I don't know for certain. So yes, it is looking good from the point of view of Hubei province. The problem is what's happening elsewhere in the world. At the moment, the rest of China is also cases are decreasing day on day. Globally, there's still about somewhere between 5 and 25 cases a day internationally, if you exclude the Diamond Princess cases. The big concern, however, is that actually, just as we're starting to get a handle on the Wuhan cases, that another focus might kick off and we might start seeing uncontrolled person-to-person transmission elsewhere. And if that does happen, that could be the precursor of a global pandemic, which would involve many cases all over the world. But as yet, that's not inevitable. Things are looking reasonably good at the moment, but we mustn't be overconfident.
And are you satisfied that whatever realistic measures can be taken are being taken to prevent a pandemic emerging?
It's difficult to see what else they could do, or what else the Chinese could do at the moment. I suspect they have implemented control measures that would be at the least difficult, if not impossible, to enforce in most Western countries. And I, for one, don't really know what else they could do to do more to prevent the spread of this infection.
And to be clear, any expectation of a vaccine or something that could help in the long run is going to take an awfully long time to arrive?
Well, I've heard varying estimates of this, but the earliest will be probably at the end of this year, maybe early next. Now, it's plausible that the disease itself would burn itself out during the summer as SARS did, but I suspect not. And I suspect that it will, if anything, come back once in the winter at the end of this year. And if that is the case, then hopefully we won't be long before we have a vaccine and enough vaccinations around to protect our most vulnerable people, the elderly and healthcare workers.
This cruise ship, the Diamond Princess, has the largest cluster of coronavirus cases outside of China. It's docked in Yokohama in Japan. 99 more cases have been confirmed on board today. That takes the total past 400. And there were over 3,500 people on board, but some have left. Here you can see a few of the 300 Americans who've been flown home overnight. 14 tested positive, despite testing negative a few days earlier. But not all Americans have chosen to leave. Here's one.
Even assuming some of the infections were acquired during the quarantine, we don't know how they were acquired, but it is certainly possible they were acquired by people not really following the rules of the quarantine. For example, while we don't have access to the decks to see how people are behaving during their open deck time, we do have access to our balcony. And throughout the quarantine period, we have seen people on their balconies speaking with each other within, feet of each other, separated by the barrier between the balconies, but with no real sense that they should be staying away from the person on the other side of the barrier.
Seems reasonable to say this quarantine system on board the cruise ship has not been a success. The process began in Yokohama on the 3rd of February, but that was after a passenger who had disembarked in Hong Kong had tested positive. By the 5th of February, well, the crisis was developing elsewhere. Hong Kong had imposed a quarantine on all visitors from mainland China, and on board this ship, at least 10 people had tested positive. Just 2 days later, the crisis scaled further. The UK was evacuating its citizens from Wuhan on board the ship. Over 60 people had tested positive. As of today, that figure is 454, and we know of them, at least 27 are from a Filipino contingent on board who work on the ship. This report coming from a newspaper in Manila. Well, here's more from that American passenger we heard from a moment ago.
We have been 14 days either within the cabin itself or occasionally out on the balcony. And the process that was quickly established following the institution of the quarantine was the crew brings meals 3 times a day. We get a choice of main for both lunch and dinner, and they drop them off. They hand them to us at the door, again, like I said, wearing gloves and plastic aprons and masks and with hand sanitizer in their possession.
Well, this is an interesting article from the New York Times headline. They escaped an infected ship, but the flight home was no haven, talking about the risks in moving all of these people back to the US. And in it, the New York Times quotes a doctor saying the quarantine on the ship ended up being an unprecedented failure. We should learn from this lesson that a quarantine on a ship is impossible, and we should not repeat this in the future. But let's be clear, that very approach is still going on right now. Rupert Wingfield-Hayes is right next to him.
The quarantine on board the Diamond Princess is supposed to end on Wednesday, and passengers had been told if they test negative, they then would be allowed to go home. But with 99 new viral cases confirmed today, the overwhelming suspicion is that the quarantine is not working. And because of that, The journey home for those left on board is now looking a lot more complicated.
Australia now says it is sending a flight to evacuate its nationals. But when I spoke to one of them, Alna Tan, she was not enthusiastic.
We're finding the thought of being put on a plane with unknown, people who hasn't been tested yet, and potentially getting the infection right then after we've already completed 2 weeks of almost 2 weeks of quarantine. Not ideal.
Japan, meanwhile, is starting to feel the effects of the virus's spread. Next weekend is the Emperor's birthday, a celebration that usually draws huge crowds of well-wishers. Today, the whole event was cancelled without warning.